Welcome to our masterclass for back pain and sciatica sufferers. Very excited for you all to be here. We've got people from all over United States. We've got people from Canada, Washington State, and I know people have signed up even from Australia. So if you've got back pain or sciatica, you are in the right place. If you have had back pain or sciatica in the past and you want to make sure it doesn't come back, you're in the right place. If you've never had back pain before and you want to make sure you never get it, you're in the right place. So tonight's going to be all about back pain and sciatica. We're going to learn why in most cases it happens, because that's really important, and that's actually where a lot of people get it wrong. If you don't figure out where it's really coming from, the treatment's going to not be right, and then you're going to continue to have problems, which is why a lot of you are here. A lot of you have had treatments in the past. You've had surgery in the past. The problems have come back. It hasn't worked. I know some of you are here because you've had injections. You've tried regular physical therapy before, chiropractic, acupuncture, you name it. Might help for a little bit of a time, but then the problem keeps coming back. So that's a lot of what we talk about tonight, and the whole point of tonight is to, again, figure out why, and you are going to walk away with immediate tips and tricks that you can start as soon as we get off this masterclass tonight to start helping your back right away in most cases. So for some of you, maybe your pain's not that bad or you've never had pain before, you're going to get a lot from this tonight. Everyone's going to get a lot from this tonight, but you may get, everything you need, and that'll be great. For some of you, though, you may realize you want more or you want to get some help from us, and we will talk about that at the end, so make sure you stay on. For the first time ever, I'm very excited. Usually we can only help people who are local to us, but tonight I'm going to be talking about a program that we are launching just for you guys. You guys are the first people who registered for this masterclass that I've created a program that I can help people who aren't local. So I'm going to talk about both of those options at the end, if that's something that you want to, if you're interested in, to see if you might be a good fit. Because like I said, some of you have had problems for a while. You're going to need a little more than the tips, but no matter what, the tips that we're going to go over tonight are going to help. So what are we going to talk about? You're going to learn why back pain is such a problem. We're going to definitely talk a lot about what people think causes back pain versus what really causes back pain. A big topic of discussion, a lot of you emailed in telling me about this, problems with imaging. The imaging itself is not the problem, but sometimes it's the way we interpret the imaging that can send you down a rabbit hole of unnecessary procedures, surgery, treatments, things like that. We're going to talk a lot about that and kind of help you to understand what's going on so that you can walk into the doctor's office armed with knowledge and you can ask the right questions. Definitely going to go over what you can do about your back pain starting right now. And of course, you'll be able to determine for yourself by the end of this masterclass whether you've learned enough to go at it on your own, or if you do need expert help, and we'll give you some options for that. Like I said, we finally have options to help people who aren't local to us, which I'm very, very excited about. Okay, so a little bit about us. We specialize in helping folks age 40 and up to be more active, healthy, mobile, so they can spend time doing what they love to do instead of in the doctor's office or even in our office, right? We don't want you here all the time, even though we love all of our clients. We really want you to be empowered through movement to do the things that you love to do. And our big thing is to help you not to have to rely on pills, procedures, or surgery. We are back pain specialists. We are also Pilates experts. We do combine them quite a bit. We combine Pilates into our treatment because, as everybody kind of knows, core strength is something that's really good for your back, but not always. So we're going to talk about that a little bit. There's a time and a place for it, but we definitely incorporate that in quite a bit. We are known for helping people who have failed kind of regular PT, we call it. We'll talk more about that. And we definitely help people take care of their own backs. That's our big thing. We want to, we help you at the beginning. We figure out what's going on, or we help you figure out what's going on, kind of get rid of your pain. But once your pain's gone, which a lot of you've been there before, right? You've had various treatments where your pain's gone away. The big problem is, how do you keep it gone? That's the key. That's what's going to give you that lifelong relief, is knowing how to keep it gone when it starts to rear its ugly head. So we definitely help people do that, and we're known for that. A little bit about me. I've been at this a while. I've been a physical therapist now and for 20 years. I've been a back pain specialist for the last, 11 or 12. I got into Pilates about the same time. I've probably literally seen thousands and thousands of backs over the course of my career and helped just about the same amount of people get rid of back pain and sciatica. I now have a team, which is amazing. I have a team of specialists who do the same thing, so it's awesome. So yeah, so that's just a little bit about me, and I do know a lot of different things. I've helped a lot of different people, so I've been around the block quite a few times, so I do kind of know what I'm talking about most of the time. And some of you are here because you've read my articles. So I do love writing those. I publish articles pretty much once a week in the paper here in Portsmouth, but a lot of times the articles find themselves on Yahoo News and things like that. So a lot of you have kind of found us that way. So that's a little bit about myself. So now let's get into it, right? So back pain is a big problem. It's no coincidence that this particular masterclass is our biggest, most popular masterclass. We typically get anywhere from 75 to 100 people signing up. Tonight is no different. And that's because so many people suffer from back problems. As you can see the statistics right here, 31 million Americans experience back pain at any given time. It is the second most common reason to visit a doctor's office. 4 out of 5 people will suffer from what we call a debilitating back pain episode at some point in their life, and about the same amount always have some sort of back pain. But that debilitating back pain episode is not fun if any of you have had it. Sometimes it has sciatica go along with it, sometimes it doesn't. But it's one of those, it's the typical, I threw my back out. Some of you on here have written to me and said this happens to me, 2 times a year or once a year, and that's not fun, and it's entirely preventable. So we're going to talk a lot about that. And then folks kind of over 40, right? It's one reason why we specialize in that age range, report the highest rates of back pain. Back pain costs a lot of money. We spend approximately $50 billion per year on back pain treatment, and it doesn't really need to be that much. A lot of people don't miss days of work because of back pain. They're not going to work, they're losing money, or sometimes they end up on disability because they haven't been able to get the right course of treatment for their back or neck pain. The spine is very much connected, so sometimes when you've got back pain, you eventually have neck pain or vice versa. And way too many people undergo surgery for back pain, 500,000 Americans every year, and that statistic is expected to go up over time, which we really want to stop that, because if any of you have read any of my recent articles, I talk a lot about that, the fact that back surgery is really only effective maybe 50% of the time. And when I say that, it's over the long term. It might seem effective right away, but 2, 3, 4 years from now, your pain comes back. So that's not really considered an effective surgery. Should last longer than that. So what causes back pain? That's a big reason why a lot of us are here. So in this slide, these are some of the things that you'll hear that causes back pain. And some of it is like entirely true, but some of it isn't the full truth. So a bunch of you have written to me and said, I've got bulging herniated discs. That is a big thing that does cause back pain. But we're going to talk about what causes the bulging and herniated discs. That's a key point that you're going to want to pay attention to throughout the evening. Poor posture, stress, weak core, arthritis, all those things can contribute to back pain. Sometimes it's all of this, sometimes it's only one of these things. A lot of you have degenerative changes in your spine. That can cause a lot of stiffness mostly. It doesn't actually cause as much pain as you would think. And a lot of you on here have what we call stenosis. That may or may not, everyone gets that as you get older. We'll talk about that in more detail in a moment. But a lot of people have that, shows up on their x-ray, and then they say that's the cause of back pain. But we're going to figure out which one it is, and you'll maybe end today kind of figure out which one of these it is. So quick anatomy review to help you understand some of the things that I'm talking about. This is what our spine looks like. On the left, you can kind of see the whole spine. That side view, you can see those curves. We have natural curves in our spine. We want curves in our spine. It helps us to absorb shock. A nice, clean, healthy spine. That's probably like a 25-year-old spine maybe. You can see all the vertebrae are nice and lined up. Get nice, plump, healthy discs. Same thing with the picture on the right. This is what your low back looks like. It looks a different shape in the upper part of your back, but we're focusing on low back today. So this is what the low back looks like. You've got these vertebral bodies, which is the bones. These are yours. This is your back here, spinal bones in the back. You've got discs that go in between the spinal bones, which help to absorb shock. And it really, so when you're moving around and carrying loads, that's what those structures are for. And then right in between all that, you've got your spine, whoops, just kidding. Right in between all that, you've got your spinal cord with, you can see those are nerve roots that come out, and they are what they supply, you know, your muscles, sensory nerves, they carry pain fibers. And when those guys get irritated, you can start to understand why you might have problems. Okay, so that's a little bit about the anatomy. This kind of shows kind of what anatomy looks like when we've got issues. So these are the structural things that actually tend to cause pain. They will often irritate the structures around these various, around your joints, which is all your vertebrae make up joints. These are all joints, all right here. So you can see that any of these things can cause irritation. That causes your pain, but we're going to talk a lot about tonight is what we really care about is what causes this in the first place. So if you fix that, you can prevent the irritation. But all that to say, likes to bother me tonight. All that to say is you've got your vertebrae over here. You can see normal disc like we looked at before. Now this is what happens when you've got a herniated disc. Sometimes that herniated disc can pinch the nerve. Sometimes it does, sometimes it doesn't. Just because you've got a herniated disc doesn't mean that you're going to have a pinched nerve to go along with it. Over here you can kind of see the different phases and what happens. Healthy disc, you've got this jelly-like substance right in the middle, and then over here you can see what happens. You get as your discs start to generate, you get different levels of forces on the outer part of the disc, which is right here. And this jelly substance, sometimes we describe it as acting like a jelly donut. If you squish the donut from one side, the jelly is going to push one way and vice versa. So that's kind of what happens over time. It's not always due to an injury. It can happen slowly over time where you just get uneven, abnormal forces on the outer part of the disc, and it eventually causes this jelly-like substance to bulge out, or eventually it can even come out all the way. The good news is that for all of these issues, you can actually, believe it or not, address them naturally. You don't need, if this happens over here, you don't need a surgery. There's a way to tell if you need surgery or not, but a lot of times they jump to surgery too soon and it doesn't always work. This is an interesting problem over here. This is when the disc literally splits off, and what they've shown in the studies for this is that it kind of, your body weirdly self-absorbs these things. So again, unless you're having very significant symptoms, which we'll talk about, you don't need surgery for that either, because your body kind of takes care of it. It's very interesting. So that's what it looks like when you're bulging a herniated disc, which I know a lot of you have, and you've told me that. That's why you're here. Then we've got arthritis and stenosis. That's a big topic of conversation. So thing to remember about arthritis and stenosis, which we'll keep reminding you of, is this happens naturally as you get older. Not everyone with arthritis and stenosis has back pain, so that's key. But this is what it looks like. You tend to get narrowing. So they call it the central canal right here, which is where your spinal cord goes through. That can get a little tighter and narrower. And then over here on the left, this just happens over time. People, these spaces get smaller as you get older, and it's just normal. It happens. If you've lived a good life, you're gonna have a good looking x-ray, is what I always say. But again, these things don't always, they're not always the #1 reason for your pain. Essentially, when you think arthritis and stenosis, think stiffness, and like with stenosis, things get crowded. So a lot of times what we say is if you can optimize everything around it, like for example, get as much mobility as you can, and strengthen muscles, get flexibility, things like that, then sometimes the arthritis and stenosis isn't as big a deal because everything else is moving really well. Because this is a part of aging, and as I mentioned, not everyone with these conditions gets back pain. So it's not the only cause and the only reason. That's going to be an important takeaway later on. Then of course we've got muscles, okay, muscles and ligaments. So you can just see there's a whole bunch here. I'm not going to go through all of them, but over here on the left, we've got the outer bigger muscles. When you have a kind of like a back spasm, these are usually the muscles that you'll feel that will kind of tighten up or knot up on you or just be stiff and sore. Then you've got these little tiny muscles on the inside. You don't really feel these too much, but these are important muscles. This is what we start to train when we are working on core strength. The muscles that are closest to your spine are the ones that we really want to train. And sometimes if you don't have a strong core, if it hasn't been strengthened properly, those muscles get lazy and can even kind of get a little sleepy. So we want to wake them up because they are important. They do stabilize your spine. And the more stable your spine is, again, like the less angry structures will get around you. And then over here on the right, we've got all different kinds of ligaments that again contribute to stability. So that's just a little bit about the anatomy to help you understand what may or may not be going on. So now, how do we figure out which of those things, you've heard me say a few times now, sometimes those things in your imaging cause back pain or are the number one reason, sometimes they're not. So how do you figure it out? Well, most of the time we get an MRI, okay? But here's the problem with imaging, okay? That's gonna be real important. So you can see over here, this is what bulging discs look like, is varying stages over here. Now, if you look at this graph on the right, these are statistics, these are studies. I didn't make this up, okay? You can see that as you get older, right? So if you look in the 40, 50, 60, 70 age range, you can see that these like everybody in this age group has a lot of these problems, okay? And not all these people have back pain, that's the thing. So you can see as you get older, you get more disc degeneration. You lose disc height as you get older. Disc bulges become more common as you get older. Things like annular fissures or like little tears in that area around your disc, and you can get just degeneration and something called spondylolisthesis, which is a slippage of your vertebrae. But you can see that it happens to everyone as you get older. Okay, so why is that important? Well, this is why. 60 to 70% of all adults without any back pain, okay, are gonna have these findings. That's why this is so important. So what does that mean? What it means is that you could take myself and someone else, exact same age, build, everything, right? Same activity level. Our MRIs could look identical. I could have terrible back pain and the person next to me could have none, but our MRIs look the same. That's essentially what this means, and that's why this is so important. Doesn't mean the MRIs are bad, doesn't mean that they don't show us important things. It just means you cannot let your MRI decide your treatment, and that's the real take-home point here. So many people go to the doctor's office, they get their MRIs, the doctor says, oh my gosh, you've got terrible stenosis, or you've got terrible degeneration, you've got this really bad bulging disc, that must be it, we better take it out. Now, just because, as I mentioned, just because that, like the bulging disc as an example, just because it's pinching on your nerve doesn't mean it has to be surgically removed. There are ways we can help it on its own, but you don't want to get surgery if you don't need it, is what I'm trying to say. So 60%, 70% of adults without any back pain are going to have these abnormalities. Doesn't mean they have a back problem. The older you get, the greater your chances are that your MRI is going to look, quote, abnormal, when really we should flip that phrase. It's really normal is what you're seeing. And this is basically what I said. It leads to unnecessary procedures and surgeries. It leads to inaccurate assumptions. So what happens is they just address the structural thing that's giving you the pain. They don't bother to figure out why that structure, that herniated disc, is bothering someone's nerve in one person and not bothering another person's nerve, even though they both have herniated discs. That's really important to take time to figure out. Because why would it not bother the other person? It's not just because you got a herniated disc doesn't mean it's going to give you a back problem, and that's the key. So what really causes back pain then? Okay, now you guys are probably all confused. This is where people get confused. Don't worry, we're going to have time for questions at the end, okay? So most of the time, and if any of you have read my articles or my column, I talk about this a lot. Most of the time, 80% of the time, in fact, what causes back pain is what we call a mechanical problem. And I've kind of alluded to that along the way up until now, but I'm going to really explain what it means in a moment, okay? So, facts about back pain. 70 to 80% of all back pain, I just mentioned that, is mechanical, okay? The good news about mechanical back pain is it can be treated naturally. That means you don't need pills, procedures, or surgery. You want to treat it naturally, in fact. You can't treat mechanical back pain any other way. Mechanical back pain happens slowly over time. It's not, you don't get an injury and bam, you've got mechanical back pain. Typically, it's caused by our life, living life, poor postural habits, lifestyle habits. For example, someone who, is a pilot their whole life, they're sitting a lot, they're bent over. That's a postural lifestyle habit that can lead to mechanical back pain over time. And then you cannot see mechanical back pain. It's not diagnosed with imaging. So that's kind of the problem, right? If 80% of all back pain is mechanical and you can't see it with imaging, you can't rely on imaging to address this, okay? So, common signs of mechanical back pain. Here's where a lot of people, when I do this class, they start to say, that sounds like me. Maybe I have mechanical back pain. Classic sign, good days and bad days, your pain comes and goes, okay? Why that's so important is because let's say, for example, your x-ray says you have stenosis, right? Stenosis is a condition where, we just talked about this, you get narrowing of your spinal canal or narrowing of the space along the side of your spine where those nerves go out. That narrowing doesn't change. It happens over time, and it's a constant state. It's narrow or it's not. So that's a great example of how your stenosis alone can't be the only reason you've got back pain if you have good days and bad days, if your pain comes and goes. Your arthritis doesn't come and go. Stenosis doesn't come and go. So that's an example of why you can't blame the structure always on what's causing your symptoms. If the pain changes or moves around, goes up and down your leg, a lot of times you see that with bulging discs. If it's moving around, it means that bulge is moving around. If you can move around the bulge, you can kind of, make it irrelevant at some point and make it go away completely if it moves around and comes and goes. If your pain kind of appeared out of nowhere, it's literally, over time, you've got, these mechanical reasons for your back pain. They happen slowly over time until one day your back's had enough. It decides to start hurting you. That's why people will say things like, I just woke up, I bent over quickly to feed my dog or pick something up and my back started hurting and now it just hasn't gone away. It's very classic. And then another big one is you will have had surgery perhaps or had injections like epidurals and things like that, steroid injections, and it didn't take away your problem. Maybe it did temporarily, but then your problem came back a few months later. That's a sign that, the problem is mechanical because injections are typically used for inflammatory problems. If your problem is solely due to inflammation, that injection is going to work. It's going to knock out that inflammation and you'll be good to go. If your problem was truly 100% related to a structural thing, the surgery should fix it. You should be good to go. When these things come back, we know that there is something else to it. That's the point, okay? Not painting these things as evil. I'm just painting these things as overdone and often unnecessary. These should be last resorts, not first resorts, okay? And then another big sign of mechanical back pain is that generally speaking, people will say things like, yeah, when I move around during the day, I exercise, I always feel good, but then it kills me at night when I lay down, or it bothers me to sleep at night, or it kills me in the morning. Very common signs of mechanical back pain. So if any of you are kind of experiencing these patterns, start paying close attention because we're going to talk about what you can do about this. Okay, so what is mechanical back pain? The technical definition is mechanical low back pain arises intrinsically from the spine, the intervertebral disc, or the surrounding soft tissues. What that means is these structures in your spine essentially are getting irritated from kind of bad habits, if you will. So the pain itself comes from the structure, but something irritates the structure. So that's the key point. If you can figure out what irritates the structure, then you can fix that, and then the structure, it's irrelevant, it doesn't matter, okay? So, if you're confused, that's good, it means you're paying attention, okay? But I'm gonna clear all this up for you before we wrap this class up, okay? So what contributes to low back pain, or mechanical back pain in particular? Lifestyle and habits and just life, right? Poor posture, or your posture, doesn't even have to be poor, your posture contributes. How you live your lifestyle, any imbalances you have in your body, too much sitting, poor mobility. If one part of your spine's not moving fully and freely, another part of your spine is going to compensate. So that's why poor mobility is important. Not necessarily where you're stiff, but where things are compensating is often where you'll have the problem. And then just poor movement habits. Maybe you just don't move very well, or you're exercising the wrong way. All these, literally fun, quick story. She might even be on here live tonight. Someone at the gym had a hand injury, and she's been working out and doing a lot of one-sided exercises. That's an example of kind of a poor movement habit. That she did that over the course of a couple of months, and then all of a sudden started developing sciatica and back pain. It's because she had, without realizing it's not her fault, poor movement habits over a period of time because she was trying to lay off the hand that she injured. So that's an example. What else? So here's some real life examples of kind of imbalanced movements that you'll find in your life. So the story I just told you, people just kind of repeatedly bending all the time, and not sort of giving your back a break in the other direction. This guy has not the greatest posture brushing his teeth. You can see like this lady on the right is doing a nice job lifting. This guy on the left is not doing a great job lifting. Now, one thing I want to say about all these postures, this is something that is sort of, I don't know, it's like a bad word, right? Poor posture isn't the enemy, okay? I know that sounds crazy to say, but what is the enemy is repeatedly having poor posture. So in a perfect world, your back and your spine should be resilient enough to tolerate, slouching over like this for a short time. It's when you do it all the time that you start to have problems, okay? So that's kind of leads, and this was the next slide. Frequency of flexion and sitting, that's the problem. So the average person on here tonight bends or flexes forward 3,000 to 5,000 times a day. So, look at it, right? How often do we do these things? A lot, okay? We sit a lot. 3,000 to 5,000 times a day is the average amount of times you put your spine in that bent or forward position. So, as we mentioned, back to that little jelly donut example, you do that over and over and over and over and over, and you don't kind of do the opposite, you're going to start to have imbalances and problems. So that's what we mean by lifestyle, and just our modern lifestyles lend to more flexion and sitting than we ever used to back in, millennia ago, right? So poor posture, inactivity. I don't talk about this as much, but let's say discs and everything are super healthy. Sometimes some of you are in here because you feel like your muscles are weak, or you feel like they're stiff, or you feel like you're gonna pull them. Something else that can happen with poor posture is a phenomenon called creep. So literally, you're in this posture, again, it's not once in a while that we're talking about, it's when you're doing this all the time. Your muscles literally start to get like stretched out over time. So it's like an elastic that you constantly stretch and eventually loses its elasticity. Your muscles need elasticity to work, and that's how they stay strong. They also kind of, they become weaker and they're easier to strain because as they're stretched out, they lose some of their nutrition. So that's another reason that this can happen on its own. It can also be in combination with underlying things like a bulging disc or arthritis or stenosis. So it's important to, this is why poor posture and inactivity is not great for you, because it can impact you on a muscular level as well. But again, it's when you do it all the time, not so much once in a while. And if you are hurting, some people I talk to, by the time they get to me, it's like I can't slouch at all. Or the minute I get in my car, my back starts to light up, it starts to hurt. Well, that's because you've likely done something like this for far too long, and now your muscles are just mad at you, and they're angry, and they're just super sensitive. So you gotta back way off and get them feeling good again. But a healthy, resilient back can tolerate poor posture. But any healthy, resilient back that you put in poor posture all the time will eventually start to have problems, aka mechanical back pain. It's just one example. So what can you do? I think you can take some guesses already. So we said it can be treated naturally. So things like mobility, posture, core strength are kind of the three big things. Now, I know what you're thinking, maybe, well, I've done all that. That's easy. Well, yes and no. You have to understand first the underlying problem to make sure you're hitting these things in the right order. One of the biggest mistakes I see is people don't restore mobility well enough, fully and freely. All our joints, elbows, knees, everything need full range of motion. Where people make the mistake in our spine is that we just don't move our spines through full range of motion often enough. So sometimes we just don't even know what that looks like. That's one of the biggest mistakes I see. Mobility has to happen first, and it has to be done the right way. And then after that, things like postural corrections and core strength are going to work a lot better. A quick tip, huge takeaway that all of you, that you can do right now. This generally shouldn't bother any of you. If it does, we definitely need to have a conversation, but interrupt your sitting. It's the single best thing that you can do for your back problem. Again, sitting itself is not bad. It's when you do it all the time. So the general rule of thumb is interrupt your sitting at least once every 20 to 30 minutes, okay? So just wherever you are, if you have a sitting job or you just like to read a lot, whatever, just interrupt your sitting. Ideally, you just stand up like this guy's doing on the right. and give yourself a little stretch, or just interrupt the posture. Or if you can't actually stand up, even in your chair, you can just kind of arch and curl your back and just get out of it. You've heard me say this a bunch of times now, it's the repetition and the prolonged nature of the posture that's the problem, not necessarily the posture itself. So if you interrupt your sitting, you don't allow the effects of the prolonged nature of sitting to happen. So that's why you want to interrupt your sitting. Make it easy on yourself. We sell these to all our patients here. We recommend them to everyone, but if you are going to sit, what this lumbar roll does, if you remember back to what that anatomy slide with the curves, this helps to maintain the natural curve of your spine. So by putting it in your low back, it helps your middle back and your neck to be where it's supposed to. So if you are going to sit, set yourself up for success by using something like a lumbar roll. If you don't have a lumbar roll, you can roll up a sweatshirt or something, and or a small pillow and stick it in the small of your back. The key is you need to have it to be pretty good size to get that natural curve. The mistake I see a lot is people don't put enough back there. And when you first do it, you won't like it, especially if you haven't sat with very good posture over the years. It'll feel stiff and you won't like it. So you can ease yourself into it, but there's really nothing, quote, bad about this. So this is another tip you guys can all walk away with tonight, okay? Extend instead of bend. So if you're in that category of your back's not that bad, if you start doing this a little more regularly, you're gonna be thanking me, and you're gonna be so glad you came to this class tonight. Some of you have gotten a little past where this is gonna be that easy to help because you've lost a lot of mobility, and for a lot of you, you avoid this movement because it's so painful, even though it might be the thing that you need. Again, this is where you need an expert to really help you walk through this, but you all can try this, and if you don't do it lying down, you can always do it standing up. It should feel pretty good, and it'll help your spine because, as we talked about, most of us sit and bend way too much. So this is something you can try, but do be careful with this one. If it hurts or you tend to avoid it, this would be one of those reasons to get help and talk to a specialist to make sure that this is a good movement for you. Every now and then it's not a great movement for spines, and we have to kind of get you back to this, but most of the time it is, so you guys can kind of try it on your own. At the end of the day, you always listen to your body to see, what it's telling you. But this is a good thing to do, and most people don't do enough of this. And then, of course, we want to strengthen your core. This should kind of come last. Everyone loves to try and do this first, but again, as we mentioned, you need to have really good mobility. Mobility first, I always say. Mobility before stability, but mobility first is key. Then you can start to strengthen around it once you've got a nice, full, a free and moving joint. Now we can talk strengthening. You want to make sure you're doing things that are safe and that are correct. We love to use Pilates here in our office. That's what these people are doing. I love, and it's not just your core. When I think core, I think abs, glutes, hips, back, all of it. So one of the mistakes I see is people doing core strengthening way too soon. Their back's not ready for it, and then they hurt themselves, and they think, oh, Pilates is bad, or yoga is bad, or I just can't strengthen my core. That's not true. You just haven't built it up properly. And then I do see people just doing things incorrectly, and then you can end up with a back injury. So you do want to make sure when you first start to strengthen your core, especially if you've had a back problem, you want to work with someone that knows what they're doing and can help you so that you do it right. And then you can see a specialist, right? Some of you don't need to, but if any of the things I've said tonight are kind of, light bulbs are starting to go off, or you're having trouble doing any of the tips that I mentioned that should help you, that's a good reason to see a specialist. When I say specialist, I'm really talking about movement specialists like what we do, because unless you want MRIs and surgeries and procedures, if you want to help yourself naturally, if you want to see if you have mechanical back pain and you want to help yourself with movement, you need to see someone who specializes in that, because that's how they're going to be able to help you. So first, correct diagnosis. Do you have mechanical back pains? If you do, then we know you can help yourself naturally. You need to restore and optimize mobility first. That's not always as easy as it sounds. Sometimes you need help, right? Sometimes things hurt, so you need help kind of balancing out the pain so that we can get you moving the way you should. After that, you want to strengthen and stabilize your spine. A lot of times that is with core. And then kind of long-term prevention strategies, good postural habits, good lifestyle habits, so that you can ideally keep your back pain from coming back. So that's kind of the gist of what a specialist would help you with. So takeaways, okay? What I want you to remember from tonight is that back pain is a problem that impacts 80% of the population. 4 out of 5 people are impacted by back pain and sciatica any given day. It's expensive, okay? It doesn't need to be though. And the biggest thing is it's often misdiagnosed, leading to unnecessary procedures and surgery, which once you start to go down that road, I always feel really terrible for people. Doesn't mean it's a lost cause, but it's just wasted time, and sometimes it just makes it harder to fix the original problem. And then the biggest take-home point I want you all to walk away with is that 70 to 80% of all back pain and sciatica is what we call mechanical in nature. Back pain is kind of what it sounds. Sciatica is when it goes down your leg, and a lot of times that's because back pain has gotten pretty bad. Sometimes you won't even have pain in your back, just pain in your leg, and that's sciatica. It usually means that your nerve is pretty mad at you, and it's gotten flared up and it's shooting down your leg, but it's all kind of comes back to the back, and it is a mechanical back problem most of the time. And mechanical back pain cannot be diagnosed with an MRI or an X-ray. So if you guys do want some help, Jill and Amanda are available right now to answer questions, but if you want help, first, if you're local, okay, they're going to put a link in the chat for you right now. It's a link to my calendar, and you can book yourself right on. This is for local people because it's in person. You're going to come to our office. It's called a discovery session. If you think you might have mechanical back pain, you want to find out if you do, and you want to see if it makes sense for you to get help. I don't take anyone on as a client who we can't help, and that we don't believe in wasting anyone's time or money. So that's what we do these for. So if you're local and you're thinking, maybe I should talk to a specialist, click on that link right now and book yourself on my calendar. I know it's been getting very full, so if you cannot find a time, look right now and see. Let Jill know. She'll take your name and email and phone number down, and we'll give you a call tomorrow or the day after and try to find another time that might work, okay? So that's for people who are local. Now, as I mentioned, I'm announcing a brand new program. For those of you that are not local, okay, we have a program series called Get Your Back to Health. There's 2 parts to it, but the first part is called Mobility First, Get Your Back to Health. I've mentioned this a bunch of times tonight. Mobility is what you need to get first. So this is gonna be a group program. It's 5 weeks, it's over Zoom, okay? It's going to be awesome. Just like we did tonight, everything will be recorded. So if you can't make every class live, you'll get a replay. It's a new program. It is a group program, so you need to qualify for it. So you can't just sign up tonight. Otherwise, I would let you. Jill, go ahead and put that link in the chat right now. That's if you're either interested in the program or if you're not local and you want help. Click on that link. That will be a Zoom discovery session with me, since I know some of you aren't here, and I just need to ask you a few specific questions to make sure that you are a good fit for the program. Because individual, we can kind of do anything. Group, I need to make sure you qualify. It's a little different. So, but a lot of you on here will. So if you're interested in either of those things, go ahead, guys, and put those links back in the chat for me, please, so people can sign up. Look on my calendar, book a time. You got to talk to me first, because again, I don't just let people sign up for things without making sure that you're a good fit. That's just kind of how we roll here. And then if you can't find something, let Jill know right now so she can take your name, email, and phone number so we can make sure we call you tomorrow and find a different time. So guys, we did a good job. That is the end of our presentation. I'm going to stop sharing my screen and we can open it up to Q&A. So who has questions? I'd love to answer some questions live or hear some takeaways. What did you learn? Anything enlightening? Don't be shy.
I have a question.
Yeah, who's that?
Hal.
Hal. Hi, Hal.
Hi.
What's your question?
Yes, it's about exercises. Are planks, push-ups, and walking helpful for sciatica?
Theoretically, yes.
Oh, good.
But it all depends, it depends on, that's one of those things where you're sort of doing, I call it phase 3, potentially before you hit phase 1 and 2. So in our world, we have 3 phases of care that we like to take people through. Phase 1, figure it out, get your pain gone, if you will, right? Sometimes there's some variance there. That's actually not that hard for a lot of people. A lot of people have done that, whether it's with pills, regular PT, chiropractor, whatever. Then you want to learn how to keep the pain gone. And then you want to then exercise, walking, things like that is part of that phase a little bit. And then those are some of the strategies that are sort of your long term to keep things, like if you've gotten yourself mobile, you've gotten yourself stable, then those are things that keep you there to ideally help prevent the problem from ever coming back. So theoretically, yes, those are all things we typically do for sciatica. But if you want to make sure you're doing it in the right order, and the easiest way to figure that out is it's either helping you or it isn't. If you're doing those things right now and it's helping you, keep doing it. You're on the right track. If it's not really helping you, when I say helping, I'm talking not temporary. Like, oh, I go for a walk and my back feels good, or I go for a walk and my leg pain goes away, but then it comes back tomorrow. That's not really helping you. It's not harming you, but it's not helping you. We want things to help and stay gone. That's the key. Does that make sense?
Yes. I unfortunately I went to stage 3 before I did stage 1 and 2. I
Listen,
didn't know.
don't feel bad. Everybody does. Everybody. And it's because we read online, hey, exercise, walk, this and that. And those things are all good if done in the right order.
I mean, they're helping with other aspects of my health.
That's
That's the
good.
thing. But
Yeah.
not for my back pain. Not for my back pain. Like I said,
Are
it
you
temporarily.
local?
No. I'm on Long Island.
Yeah. Well, sign up if you want. If you're interested in that group program, it could help you because we're going to be going through some of that. And I just need to make sure you qualify first. But if you want to sign up for that, I think someone just put it in the chat for you. Feel free, and I'd love to talk with you more.
Okay.
Cool. That was a great question, though. Excellent question. That's a lot of people get confused there. Who else has a question? That was a great one. Good kicking us off, Hal.
I ask you about my standing desk,
Who's that talking?
Michelle.
Michelle.
Sorry.
Yes.
So
Yes.
I talked my boss into getting me a standing desk a few months ago, and for like the first month it was great. But now I have back pain whether I'm sitting or standing. So I feel like maybe the standing desk caused a different set of problems.
Okay, that happens. Is it just in your back or does it go down your leg?
No, it goes down my right leg. Like originally my pain was only in my right leg, and now it seems to be in my back and my
Okay.
legs.
Are you local or are you far away?
No, I'm the Canadian.
Okay. All right. So it's a little tricky for me to answer, but two things. So first of all, almost the opposite answer I gave Hal. Any things that are good, like our bodies are, they try not to make things that difficult. Things that are good for you, like you feel better and you stay better. Like the
Right.
stay better is the key.
Right.
Things that your body doesn't like, you'll feel pain and then it'll start to get a little worse, which it sounds like you're in that category.
Mm-hmm.
So you remember I talked about those discs. So it goes right along with Hal's question actually. Typically, standing, walking, all that stuff is good for your back. Every
Yes.
now and then, it's not. And what I mean by it's not yet, that's a perfect example of where we absolutely need to really make sure we restore your mobility the right way.
Right.
And the standing and all that should be good for you. So your body's telling you there's something going on in your spine where when you stand too long,
Mm-hmm.
it's irritating something and you're starting to get angry. So at the
Right.
very least, you could mix it up, sit and stand, but that is
Yes, I
something.
do.
Yeah, and it'd be one thing if you just told me your back gets sore. That could actually be a strength thing.
Mm-hmm.
The fact that it's starting to go down your leg tells me it's probably not a strength thing. It tells me that something's getting irritated because
Well, my leg was the first problem, and then I didn't really have, and I know it's straight. Like I have a very weak core. So
Okay.
what you were saying before, it's like, oh, I got a weak core. I got to try and strengthen my core, and I do like 2 days of exercises and hurt myself, and then stop for a year.
Yeah.
So that's why I'm totally interested in your 5-week mobility.
Yeah, sign up for that.
thing.
You and I will have to talk first to make sure that
for
you
sure.
can do it. But
Yeah.
definitely sign up and hopefully it'll be something that you'll be a fit for and we can do. And just so you guys know, it's going to start February 21st. Just same night, Tuesday nights from 6 to 7. So we got some time. But yeah, sign up for that and we'll see if that can help you. But definitely that's more than just like weakness is from what I'm hearing that you're telling me. So that was a good question.
Okay, so it's the link that says new online program. Okay, there it is.
Exactly.
Okay, great.
Excellent. Great questions, guys. Who else has questions? Or
This is
takeaways. What'd you learn?
this is Susan. Can you hear me?
Yes, I can. Hi, Susan.
Oh, okay. Well, I'm calling from California and I'm in a parking lot on my cell phone, and I cannot see any place to click on to get the information for the 5-week program.
Okay.
You might have to scroll down in the chat. That's what I had to do.
Or why don't you guys just put it? Can you see the chat, Susan?
How do I see the chat? Is that little icon with a?
Try
I'm
that.
not sure.
Yeah. Try clicking on that icon and see what comes up.
No, nothing happens on that.
Actually, maybe we can. Let me just see something. I think Jill or Amanda, I think try to see if you can private message her. I don't know if you guys can do it from your end and maybe something will pop up on her screen. So you're looking to sign up for that mobility one?
Right.
Okay, well, if we can't figure it out tonight, you will get an email with all the links. Everybody will. So just reply.
Okay.
Like, you'll be able to do it from there. And if you have any trouble, call us or email us.
Okay, great. Thank you.
You're welcome. Who else has questions? And/or I'd love to hear takeaways, what you learned.
Hi, this is Kelsey.
Hi, Kelsey.
Hi. I was curious just what your thoughts are on how chiropractic can work in conjunction with what you do. Over the years, I've had times where it's helped, and then other times where it's actually caused me a lot of pain and made things seemingly worse. So yeah, I'm just curious your thoughts on that.
That's a wonderful question. So with chiropractic versus kind of what we do, the first thing to note is that it's a passive treatment, meaning it's kind of done to you. So you go and they're manipulating your spine for you instead of sort of you doing it on your own, which isn't bad or good. But to your point, first of all, whenever someone tells me that they go to a chiropractor already and the chiropractor helps them, I immediately think, ooh, yes, mechanical back pain. Because guess what? That's the definition of the pain comes and goes. If a chiropractor can make it go away, then it means it's mechanical because he's literally manipulated a structure and changed something that has changed your pain. So that's the good part. Why sometimes it doesn't help is because not all chiropractors, but with some of it, with many, it's not always super specific. So because they haven't done, this is not all of them, this is kind of a general statement. But if they haven't done kind of movement tests to determine accurately where the problem is coming from, because again, chiropractors do look at x-rays. They figure things out that way. They do more than a doctor will, but they don't do movement like we do. And remember, mechanical pain is inherently a movement problem. So if depending on how your back is behaving, if they manipulate your spine in a way that doesn't go along with what it needs to help, you can actually feel worse. So hopefully that answered your question. It really comes down to the fact that if it's not super specific, then it can go either way. It's not bad or good. It's just that it all comes down to the very first thing you need to do with any problem, not just back problems, is be accurate about where your pain is truly coming from, aka the root cause. You got to always get that right first and be really clear about it. You should be able to kind of reproduce it and take it away. If you can do that, you know you've got the right cause. Then you can start to treat it and see what happens. When you sort of guess and you're not doing things specific, that's when you'll get lucky, it'll help, or it might not. Does that answer your question?
Yeah, that's helpful. I've actually had times where the chiropractor has helped, but then has seemingly caused like muscle spasms and things that don't seem like they're actual related to the spine. And so that is probably because there's issues coming from other places.
Or again, it's a passive thing done to you. When you are actively involved in your own treatment and moving on your own, you have an opportunity for your body to give you information along the way so that you can scale back or push more. It's kind of an all or nothing sometimes with the chiropractor. So on those days where you got muscle spasm, that could have been a day where you needed to back off a little and you won't know till it's too late. Does that make sense?
Yeah, that's helpful. Thank you.
Yeah, great question. You guys have great questions tonight. I love it. Who else has a question? And or I always like to hear takeaways. I want to hear what you learned.
This is Sue.
Hi,
I have
Sue.
a takeaway.
right.
I read all of your articles in the Foster's Daily Democrat, and that's how I found you. And
Great.
they're very, yes, very instructive. I thank you for
Oh,
putting
thank
this
you for
in.
that. And
It's
thank
very
you.
important. Yes.
Thank you. Thank you very much. Who else? We have another minute or two. Any questions or takeaways? Things you learned? Someone tell me one new thing they learned tonight about back pain.
Mm.
I think Sally, are you trying to talk, Sally? I can always tell.
I'd like to say that you gave me hope tonight,
Oh,
most
good.
definitely. So hope was the good thing, because I like the more natural way that we have control over our bodies, that we have the ability to cure ourselves or work with somebody who can get us there. So that I got a lot of hope tonight.
Excellent.
Thank
Good.
you.
I'm glad
Thank you
to
for
hear that.
that.
You're welcome.
I have a takeaway. Yes, I do. I do a lot of sitting.
Who's that?
Hal.
Okay, Hal. Yes. What was your takeaway?
Yeah, I do a lot of sitting, and my takeaway is that I should get up every 30 minutes and stretch my back, and I never thought of that.
Got it. That was a good
Also
takeaway.
Yeah, and put a pillow or something on the curve of my back. I never thought of that either. I'm going to try those two things.
Perfect. Yes. Very good. I love that takeaway for you. Sally, go ahead. What were you trying to say?
Well, I agree with Deb. It does give me hope. Yes. And that if it comes and goes, then it's more of a mechanical problem than a structural problem. I think that gives me hope. Knowing that.
Great. Good.
Yeah.
Good. I'm so glad to hear that. All right. Anybody else, or we feel pretty good? All right. Give yourselves a round of applause for hanging out with me for about an hour. Thank you, everybody, very, very much. You'll get an email with those links in case you missed it. And we're here. Let us know if you have more questions that come to you after, if you need any help. And if you have friends that maybe that need to hear this, let them know. We can send them the replay, or if you're thinking about doing the program, have a friend join you. It's always more fun with friends. So, all right. Bye, everybody. Have a great night. Thank you so much for joining us.
Thank you.
Thank you.
Thank you.